one for now. So effectively, I'm talking through the podium mic. They won't be using the podium mic, so don't worry about the fact that there's a slight amount of amplification. I'm going to switch over to the handheld now, which is what they will be using. 1 2 1 2 3 1 2 3 4 testing 1 2 1 2 3 1 2. I'll go up on stage so you can hear what it's going to be like when they're using the mic. Mic test, Foster Lecture Theatre from the stage. 1 2 3 4 5. How's that for you? Good. Cool. Well, that's all we need to do, really. I'll say no more on that, and we'll keep it. We'll keep the communication open just in case anything does fall over. I doubt it will because it was solid last time. Once we got it going. Perfect. The main thing is we don't need to do any edits because we've already got the slide. The holding slide's got the QR code. And we've tested the audio and video, so we know that's already working. So always a good sign. Cool.
Yes, it is. All right. Well, thank you, and guess we'll see you in a couple months.
Something like that. Yeah. No worries. All right then. See you later. Bye for now. It's up and running. Live on YouTube.
Okay, we're going to start our ceremony. So first of all, welcome to everyone here today, those online watching from home, guests and our invited speakers, and a welcome to the deans, students and our faculty. So this white coat and celebration is being streamed on the AUC YouTube for friends and family to enjoy, and a special warm welcome for family members and friends in the audience today. On the stage today we have AUC's Dean Mark Rosenberg, who will give one of our keynote addresses, together with Chandelier Macharaju, who's our clinical student, giving a keynote speak after the white coat. Our UK clinical deans are Deans Kirkland, Ash, Scobie and Jameson, and welcome also to the Director of Wellness Counselling, Melanie Shinnett. You've been with us since the start of January, yet I hope you feel part of the AUC learning community, a community that celebrates 98% first-time residency attainment rate for graduates last year. The white coat ceremony signifies your personal transition to the medical school at AUC and the start of the formation of your professional identity. So I'm going to invite Dean Rosenberg to say a few words of welcome.
Thank you, and it's a pleasure to be here. Happy Valentine's Day to everyone. I got reminded early this morning to send my wife a Valentine's card, which I did, so I'm covered. So welcome students to the AUC School of Medicine. You know, we're proud of our school and pleased that you have chosen us. We look forward to working with you over the next 4 years and beyond. You have all accomplished much in your lives already, deserve to be here, and hold the promise for so much more in the future. A special welcome to our faculty and to any of your guests who are either here or maybe listening in, and to your fellow students as well. Having the support of your family will be really important as you navigate your journey through medical education. Personally, I have always viewed medicine as a dream profession. Although the road you have traveled to reach this point has been challenging, and the one ahead will be equally daunting, the journey is profoundly rewarding. As I reflect on your path, it reminds me of a Bruce Springsteen song. Everything, it seems, reminds me of a Bruce Springsteen song, which includes the following passage. I'm working on a dream, though sometimes it feels so far away. I'm working on a dream and know it will be mine someday. I'd like to say a few words about the history of the white coat ceremony. In the late 1980s, Dr. Arnold Gold and his wife Sandra established the Gold Foundation in the United States, as they described, quote, to nurture and preserve the tradition of the caring physician, unquote. The Gold Foundation introduced the white coat ceremony in 1993 at Columbia University in New York. It's now a ceremony performed at, I would say, most medical schools across the world. Ceremonies such as this are considered a rite of passage as students are welcomed into the profession. The beginning of this journey starts with an oath to obligate you to high professional standards for patient care and the practice of medicine. These standards focus on the development of the humanistic physician, one who demonstrates integrity, clinical excellence, altruism, respect, empathy, humility, and service. The real meaning of the white coat ceremony is in the words of the oath. The white coat itself is just a symbol. It's an honorary and physical embrace from your colleagues. It is a hug and a blessing. The oath that you will take reflects your commitment to the profession. So the road is long, deeply rewarding, and at times not easy. But this work is a tremendous privilege. We are all granted the privilege of partnering with our patients to improve their health and well-being. Remember this embrace of the profession that the white coat symbolizes. Welcome to our community. You belong here. We are here to support you, to walk with you along the way, and to help you keep working on your dream. Thank you.
So students, during today's ceremony, you're going to carry your white coat onto the stage and you're going to don it with the help of Dean Rosenberg. We do have a bit of a theme of Valentine's today. That's why we're dressed in the way we are. We also have some roses for you, for those who are the white coat recipients. So Dean Kirkland is going to give out the roses, and Dean Rosenberg will be there to don the white coat, standing by the sign. So starting with our white coat recipients, would you like to stand up, please? So Hannah Abdul Rahim. Do you want to get your rose? I think, well, they just have to. Yeah. So, Anusha Abdul Salam. Parsa Bandemiri. Tina Adele Chaloub. Noor Hachem. Mariam Jadun. Joshua Curavilla. Dania Mahmood. Wella Malambo. Amar Razak. Toma Reznikov. Mahek Shah. Anila Singh. Balreen Singh. Adam Ziabari. Sophia Yamani. And Archana Krishna Gopal. So well done, students. We're now going to invite you to come back onto the stage as a group. And if you could bring your oath, the small card that you've got. And you're now going to recite the oath led by Dean Scobie.
Thank you. Yep.
We welcome other physicians if you want to stand as we recite the oath. You give the instructions first.
So, students, if you could repeat after me. I swear to fulfill to the best of my ability and judgment this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply for the benefit of the sick all measures that are required, avoiding those twin traps of overtreatment and therapeutic nihilism. I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say, I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me, that the world may know. Most especially must I tread with care in matters of life and death. If it is given me to save a life, all thanks, but it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body, as well as the infirm. If I do not violate this oath, may I enjoy life and art, respected while I live and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. You don't want to give me a song.
So well done, everybody. So I'm going to now invite Shandy to speak to you all today. Shandy joined the course in May 2022, passing step 1 in March 24, and has completed his rotations in Stepping Hill Hospital in Manchester in medicine, surgery, psychiatry, OBGYN and paediatrics. So welcome, Shandy, to talk to students.
Good afternoon, esteemed deans, faculty members, fellow students, and last but not least, friends and families that have joined us from around the world. It is an absolute honor to stand before you today as we celebrate a truly momentous occasion, the beginning of AUC's class of 2025 journey into the world of healthcare. Today, as you, the future clinicians, put on your white coats, and you're not just donning a piece of clothing, you are stepping into a lifelong commitment to healing, compassion, and service. This white coat is more than just a piece of fabric. It represents the knowledge you will gain, the integrity you will uphold, and the compassion you will bring to every patient you will encounter. It signifies your commitment to lifelong learning, resilience, and service to others. The path ahead will be challenging. There will be long nights, difficult decisions, and moments of doubt. But remember this, you belong here. You have earned this moment, and you're capable of greatness. When things feel overwhelming, remind yourself why you started. Think of the patients who will one day look to you for guidance and reassurance. Medicine is built on foundation of science, on the tireless pursuit of knowledge, discovery, and innovation. The principles of physiology, pathology, and pharmacology that you will master are the very tools that will allow you to diagnose, treat, and heal. Though, while science provides the answers, it is your critical thinking, adaptability, and passion that will turn your knowledge into life-changing care. Remember that even after completing med school and having attained your degree, your learning is not over. Medicine is always evolving. Be mindful, medicine is not just about science, it is about people. It is about listening, learning, and leading with empathy. Over the next couple of years, when you transition into clinical placement, it will be some of the most transformative experience of your journey. This is where textbooks come to life, where diseases have faces, where treatments have real consequences, and where you will witness both the vulnerability and strength of human spirit. So far, in my clinical placement at Stepping Hill in Manchester, I have witnessed first-handedly how the knowledge gained in this very institution translated into real-world practice. One moment that really stood out to me was seeing how seamlessly a multidisciplinary team came together during ward rounds. How the consultant or the attending physician, nurses, physiotherapists, and pharmacists collaborated effortlessly, each playing a vital role in patient care. The structured approach, the efficiency in communication, and the way the clinical decisions were made in real time mirrored everything we had learned in lectures and case discussions. It was a powerful reminder that medicine is not just about individual expertise, but about teamwork and shared knowledge in action. I have seen rare clinical diagnoses that I was once taught in the lecture rooms of this very campus, deepening my understanding and appreciation for the complexities of medicine. Clinical placements have reminded me why I chose this path. It will one day do the same to you. They will test you, but they will also reward you in ways you cannot yet imagine. I will never forget the first time I stepped into the operating room. The anxiety, the excitement, the fear running through my veins were exhilarating. Not just as an observer, but as an active participant. The bright lights, the sterile precision, the quiet intensity of a team working in a perfect synchrony. It was both overwhelming and exhilarating. As I stood beside the surgeon, hands steady, heart pounding, I felt the weight of the responsibility and the privilege of being something greater than myself. The moment I first assisted in surgery, I first-handedly saw the precision of a skilled surgeon, the calculated movements, the delicate balance of decisiveness and caution, an unwavering focus that transformed knowledge into healing. I was amazed at the precision, not just during the operation, but also leading up to it. There were so many preparatory steps that were undertaken before the patient was close to being admitted to the operating room. I had the privilege of assisting in procedures such as laparotomies for the reversal of Hartmann's, rectal cancer resections, appendicectomies, hysterectomies, cholecystectomies, and the list goes on. With each case, I became more attuned to the rhythm of the operating room, learning to anticipate the next move, to work seamlessly with the team, and to understand the immense trust placed in us by every patient. These moments reinforced that medicine is not just about knowledge, but about skill, precision, and adaptability. And soon, you too will take these steps, whether being in a ward, a clinic, or an operating room, where your learning will extend beyond textbooks and into the real world. It may feel overwhelming at first, but with time, you will gain confidence. And one day, you will look back and realize just how far you've come. But let me tell you, some of the most impactful lessons will come from the moments that you least expect. It may be the patient who thanked you for simply listening, the senior doctor who challenged you to think beyond the obvious, or late night studies where everything suddenly clicks. Embrace these moments. They will shape you not just into a better clinician, but into a better human being. Never underestimate the power of small gesture, a reassuring touch, a kind word, or the willingness to go the extra mile. As you take your first steps in this journey, embrace the learning process. Be curious. Be humble. Always ask questions. There are no stupid questions. Support one another. You are not alone in this. The peers sitting beside you today will become your colleagues, your friends, and your greatest support system. There will be challenges ahead, but each challenge is an opportunity to grow, to become stronger, wiser, and more prepared for the incredible responsibility that lies ahead. Congratulations to each and every one of you. Wear your white coat with pride, with compassion, and with unwavering belief that you can and will truly make America great again. Welcome to the beginning of an extraordinary journey. I like to end with one of my favorite quotes. The best healthcare professionals are not just those who know the most, but those who never stop striving to be better. Thank you for having me, and all the very best.
Well, that was a great speech. So we're moving on now to our celebration of academic excellence. So the second part of today's ceremony, we're recognising academic effort and mentorship, those who show commitment and dedication to our AUC learning community. Students who made the Dean's List have an average GPA of 87% or above last semester and have shown determination and effort to learn the medical sciences. We're pleased that 9 students made the Dean's List for academic excellence in the September semester. Each is going to receive a Dean's List badge to wear on their white coat, together with a small trophy from Dean Rosenberg. So our Dean's List recipients for Semester 1, Emilia Marcellek. Semester 2, Sorin Park. And Carly Costello. Semester 4, Julia Bianco. Yi Jing Lee. Now, semester 5 aren't here, they should be studying for step 1. But those students are Ans Faruqi and Charlie Pagai and Trung Tram. Trung's here. Glad he made it. Thank you, Dean Rosenberg. Moving over to Dr. Sue Jameson, who's going to lead the course awards for student engagement.
Okay, so I'm going to read out the clinical medicine ones first. So for clinical medicine semester 1, we've got Ava Ruzwagusho. Semester 2 Hode, Ria Maka. Semester 2 MSD, Carly Costello. Semester 3 Cav, Kezia Badu. Semester 3 Ra, Nusrat Mia. Semester 4 Jin Manav Sangha. Semester 4 ENR Rishika Gowda. Semester 5 B&B Nakichet Joshi. So now I'm going to do the overall module awards. So for M2M, it's Emilia Marszalek. For Hode Sorin Park. For MSD, Carly Costello. For Cav, Julia Stanbury. For Ra, Joy Anyim. For Jin, Jenny Lee. For ENR, Tatum Rath. And lastly, for B&B, Trung Tram. I'm now going to read out the mind-to-mind mentors, but I'm going to read them out all as a group. So if you'd like to just come up on stage all together, please, that'd be great. So mind-to-mind mentors: Soren Park, Seba Mostagim, Aidan Weintraub, Ria Maka, Manav Sangha, Liran Kazatska, Away Swatu, Joy Anyim, Funky Amatoso, Harshini Shan, Rishka Gowda, and Devaran Singh Chown. Got these. Mind to mind. Monitors. You're just going to come. Okay, so the next list is S4S. I'm going to read them all out at once in a group. Again, so we've got Julia Bianco, Aidan Weintraub, Anna Ayres, Soren Park, Carly Costello, Thanvi Gulapilli, Veronique Hillo, Liran Kazatska, Tatum Rath, Manav Sangha, John Kingston.
Great. Okay, Julia. Anna. Sorry. Carly. Sandy. Veronique. Helen. Katie. Manav. So now we're going to do Honour and Service Awards. These are for 5th semester students. So we're going to congratulate students recognised by AUC for their honour and service during the first 4 semesters. And we're going to wish them well in their final semester of medical sciences. Each student is engaged in community and extracurricular events and maintained a cumulative GPA of 85% or above. Eligible students submit their application to Dean Humphrey, and to the 4 students for honour and service, I'm going to ask Dean Rosenberg to give out the awards. Julia Bianco. Jacqueline and Jabo. Yi Jingling Li. And Tatum Rath. So Dean Rosenberg, I want to acknowledge the outgoing president of the SGA with an award recognising his contribution and effort supporting the AUC community in the UK. Being the SGA president requires a person committed to the AUC community of students, willingness to raise issues and support others in their medical journey. The award, in recognition of service as the UK SGA president for fall of 2024, is John Kingston. Our next award is the MERP Award for a student who's excelled in the UKT Medical Sciences course and joined the AUC programme through its Medical Readiness programme. So we will recognise a student whose academic achievements to succeed through hard work, talent and motivation started with a MERP opportunity. So our recipient is Mohammed Watu. Where's... So my final award is the RISE Award. So we select a RISE recipient to acknowledge resilience, inclusion, service and excellence. This was a concept developed in 2019 by the Student Government Association as a guideline for the conduct at a typical AUC School of Medicine student should exemplify, as well as a set of standards by which students hold each other accountable. So resilience is to meet adversity with fortune and zeal. Inclusion is about encouraging an open community of interest, bond with others through academic excellence. Service is to exhibit humility and accountability while dedicating time and service for the prosperity of others. And excellence is to maintain the highest standards, academic honesty, the campus atmosphere that is conducive to learning. And so for her contribution to UKT, for tutoring, for chairing S4S, the RISE Award goes to Juliet Bianco. You're certainly collecting chocolate anyway. So we're going to now move on to the Faculty Appreciation Awards through the UK SGA. So I'm going to invite Joy Animium, to the new SGA president, to come on and say a few words and give out the Faculty Awards. You have to hold it quite close.
Starting with the M2M award. This award goes to a professor that broke down pharmacology, a subject particularly found difficult, especially in the first semester. He made this subject way less frightening through his amazing Q&A sessions, his reviews, making sure all students knew all the drugs, especially their mechanism of action, adverse effects, his engaging lectures, constant revisions, and patience in answering our endless questions have made learning a truly rewarding experience. Your enthusiasm for the field of pharmacology and this commitment to your student never went unnoticed. We are beyond grateful for this knowledge, wisdom, and kindness. The M2M award goes to Dr. Sujit. The next award for the whole module goes to a professor who's been nominated for this award for her unwavering dedication to giving students true and initially make this whole module very much understanding. The whole module is a very difficult feat. Its sheer volume of information was daunting, and the level of memorization required was intimidating. But this professor went above and beyond, ensuring we had the tools and the strategies and the confidence to succeed. She not only provided us with ample practice questions to prepare for our exam, but she also fostered engaging and dynamic learning environments. As a module lead, she advocated for her class, making sure that the class concerns were heard and that effective solutions were implemented. Her commitment to both education and well-being did not go unnoticed. She kept students engaged and challenged them to think critically, making the subject as intricate as microbiology truly enjoyable. We are incredibly fortunate to have her as a professor, and her passion for the medical microbiology, her exceptional teaching style, and her ability to make us feel confident in tackling even the toughest questions set her apart. And this honor to present this award goes to Dr. Padillat. The next nomination goes to a professor for the MSD module. She went above and beyond to ensure that we understood the intricate concepts of anatomy. She also helped us understand high yield points essential for success. She turned what could have been an overwhelming flood of unfamiliar muscle names into something we could grasp using mnemonics, creative memory aids, and teaching style. We are truly fortunate to have such an exceptional professor here at AUC, one who not only understands the subject inside and out, but also understands how to make her students succeed. Today, we would like to honor Dr. Soni. Congratulations. And for the CAV module, the award goes to a professor whose dedication to teaching and hard work reminds students of their potential and has made lasting impacts on our medical education. With an exceptional talent for simplifying complex concepts, she has inspired and guided us through turbulent flows of physiology. Beyond her expertise, she's known for delivering uplifting pep talks, providing encouraging words to students that could really use them, and most importantly, group yoga classes. The CAV Faculty Award goes to none other than Dr. Vishali Khatri. The next award for the R&R module goes to someone who teaches not only clinical skills and ethics, but also acting skills. She has an incredible ability to motivate students, even when they are at their lowest, such as when an OSCE did not go as planned. Her knowledge and confidence in the clinical art truly makes students see healthcare situations in eye-opening ways, shaping them into not only capable, but also compassionate medical students. The R&R Faculty Award goes to Claire McKenney, although she's not in due to a well-deserved vacation right now. Thank you. And for the next module award, this goes to a teacher who turns anatomy from a challenge to a joy. With her crystal clear slides and concise explanations, she makes even the most complex structures feel simple. Her clever mnemonics have saved us more times than we can count. Her fascinating stories about the origin of big anatomy names reminds us that medicine is not just science, it is history, discovery, and wonder. But beyond her brilliance, it's her kindness and patience that makes her unforgettable. She lifts us up, encourages us, and makes learning feel exciting rather than overwhelming. And this award for the Gene module goes to Dr. Sinclair. The award for the ENR module goes to a professor whose classes are always fun and interactive. Without taking away from being extremely informative, he taught us in a way that could make sure students would remember everything. His voice rings in our heads, rings in everyone's head during exams. No one would ever forget the hyper and the hypo. To top it off, he celebrates the end of a module by treating the class to his family delicious samosas. And this award goes to none other than Dr. Rao. Thank you. I have a few things prepared for the semester 1 students. First, I'll start by saying good afternoon, everyone. To our esteemed faculty, distinguished guests, proud family members, and friends. I am honored to welcome you to this momentous occasion. And to our new white coat wearers, I am thrilled to congratulate you on this significant milestone. Today marks a significant milestone in your journey, a moment of transition as you don the white coat for the first time. This coat does not just make you look sharp, which you all do. This simple piece of clothing carries profound meaning. It's the symbol of knowledge, responsibility, and above all, compassion. It represents the trust that patients will place in you and the commitment that you're making to their well-being. This ceremony is not just about putting on a coat, it's about embracing the values of integrity, empathy, and dedication that defines the medical profession. It signifies your first step towards a lifelong journey of learning, of growth, and service. You're stepping into a profession where science meets humanity. Medicine is not just about diagnosing diseases or prescribing treatments. It's about listening, understanding, and being present for those in need. Your patients will look to you not only for your expertise, but also for your reassurance, kindness, and hope. Let's be honest, this part is no walk in the park. The road ahead will be demanding, filled with long study nights, endless OLMs. There will be days when the material feels overwhelming, the cases seem confusing, and moments where you question everything, including why Anki refuses. Anki reviews won't just stop coming. But amidst all this, there will also be breakthroughs, friendship that feels like family, and moments that remind you exactly why you chose this path. Every difficult chapter, every late night study, and every patient you would encounter in the future would shape you into the physician that you were meant to be. As your SGA president, I want to remind you that you're not alone in this journey. Lean on your classmates, seek guidance from your mentors, clarify things with your professors, and never hesitate to ask for help. There are many student clubs and associations that organize events to help you unwind, as well as workshops designed to help to support you in navigating medical school. I encourage you to take advantage of these opportunities. We are all in this together, and together we will succeed. Lastly, as you embark on this extraordinary path, embrace the challenges, cherish the victories, take breathers, and never forget why you started, because the world needs physicians who are not only skilled but also kind, not only knowledgeable but also compassionate. Treat every patient with dignity, respect, maintain an insatiable curiosity for knowledge, and always lead with compassion. To the families and friends here today, thank you for being an ultimate support system. Whether it's reminding the students to eat something other than instant noodles or being their personal cheerleader, your role in this journey is invaluable, and your unwavering belief in us is what makes this dream and this journey possible. Again, to our first semester student, I say congratulations. Wear your white coats with confidence, with humility, and the determination to make a difference. The road won't always be easy, but it would be worth it. Now take a deep breath and enjoy this incredible journey. Thank you.
So we're at the close of the ceremony, so I want to thank everyone here present who's participated and welcomed our newest students into the medical school. And we've been able to acknowledge just some of the achievements of our students, and you are great students. I want to thank the UK SGA for all the work they do, for the volunteering, everyone involved in supporting each of you and creating what is a really great learning community. We've recognised some of our faculty today, and I want to thank all of our dedicated faculty who are committed to your success. Thanks to our AUC Deans, Dean Rosenberg, our clinical Deans, Dean Ash Scobie, Dean Kirkland, to Shandy for coming from clinicals, to give us keynotes and insights and make this event full of encouragement. So I really look forward to celebrating your future achievements and recognising your future efforts as you progress through this programme and always be part of the UK track. So I hope you've enjoyed this ceremony. Welcome you to our school community and your future participation in life of the AUC Medical School. So thank you very much. So there's an opportunity for students who've won awards, particularly for students who like to go back on stage, maybe as groups, and have some photographs. There are refreshments in Foster Building, which is, as you go out of here, turn right and then left. And then we've got some food for everybody. I hope you can enjoy to celebrate for a few hours longer.